The importance of good mental health is becoming an increasingly talked about subject in all areas of life. It is particularly important to think about when a young person transitions to their next level of education. We asked some students how they define mental health and how their awareness of mental health and overall well-being changed while attending higher education.
Sí, para mí la salud mental es el estar bien, el sentirte bien tanto psicológicamente como también físicamente, porque también tiene un impacto, ¿no?, en tu salud, el estar bien psicológicamente y físicamente. En verdad a veces está relacionado, si tú estás bien físicamente, mentalmente vas a estar mejor la mayoría de las veces. Y supongo que también al revés. Deporte. Siempre deporte, o por ejemplo cuando no se puede hacer deporte, hace mal, etc., siempre estar con alguien, estar con los amigos, viene muy bien, sobre todo porque los niveles de serotonina, por ejemplo, pues son mucho mejores. Cuando acabas de hacer deporte te sientes mucho mejor, o bueno, eso es lo que sirve para mí.
I would define good mental health completely differently now compared to how I would have described it about a year ago. You know, to me now it's in a way sort of being comfortable and being able to talk about anything and not necessarily just what's bothering you or what's good about life. I would define it as having the courage to actually speak up for yourself and be able to speak up about how you feel about things and not feel as if it's weighing you down all the time.
Pues yo creo que la salud mental es sentirte a gusto contigo mismo. A mí me lo dijo un amigo mío, me lo dijo una vez: en el momento en el que tú disfrutas estando solo es cuando ya tienes un nivel de salud mental a gusto, porque yo conozco mucha gente que cuando está solo pues o le vienen todos los problemas de golpe o se pone a pensar en cosas que había hecho mal en el pasado y no ha podido tal. Yo creo que tienes que estar a gusto con las decisiones que tomas, porque si las tomas es por algo, y eso, yo te lo resumiría en eso: cuando tú disfrutas estando solo, yo creo que ya tienes una buena salud mental.
No, yo creo que piensan en ello, pero no tienen el concepto ni las herramientas. Aparte que yo creo que hay un problema, y es que hay mucha falta de información y al final ellos lo asemejan a una enfermedad. O sea, no tienen una buena salud mental, ellos ya piensan que es que hay algo que no está bien, que están enfermos. Una buena salud mental, yo creo que estar en paz contigo mismo. Para mí esa sería la salud mental perfecta.
Okay, based on my own experience, I would define good mental health as being consciously aware of how you feel and being present to the moment, and being aware of your coping strategies you've built up from your experiences in life, and being aware of your resilience, and when you do have a challenge, to take a deep breath and work on your coping strategies. But however, if at times you're feeling anxious and you're feeling that the challenge is too strong for you, then seeking help, being able to source outside help.
I would define mental health as a state of mental well-being. It could be, you could divide it into two. It would be good mental health or bad mental health. I would define good mental health as, being able to cope with your emotions and being able to manage your stress in healthy ways, whereas bad mental health is not necessarily just associated with like depression and anxiety and all that, but maybe just, not really feeling yourself and just kind of feeling under the weather sometimes, and just maybe feeling overwhelmed with stress and, other commitments. But yeah.
Defining mental health. When I think about mental health, I think about a state of well-being. And I think this is something that everybody has. We all have mental well-being. However, when we think about good mental health as opposed to poor or bad mental health, that's also another story. if you asked me to define what good mental health is, that to me amounts to getting up in the morning, feeling good about yourself, looking at yourself in the mirror and feeling, I want to go out and face the world. I'm ready to face challenges that the day brings up to me. However, if you're asking me about my understanding or what I think about poor mental health, that's the opposite of good mental health. That's somebody probably struggling to get out of bed, looking at the gray skies, thinking, what is the day going to hold for me? Will I be able to help? And possibly struggling to get out of bed and maybe not even getting out of the bed. And I also think that poor mental health for me means how people struggle with things that may look like normal day-to-day chores. I mean, we take it for granted that you go by your day and you just get a cup of tea and you go meet friends and so for someone with poor mental health, those actually can be chores. They can be difficult tasks to get through during the day. So that's in simple terms, that's my differentiation between good and poor mental health. But I think we all have mental health.